Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah, Kaleida Health Manager, Workforce Development. Here on WUFO Power 96.5 FM and WUFO AM 1080 AM. And I just want to say, Kaleida Health, who are we? Kaleida Health. We are Buffalo General Hospital, Gates Vascular Institute. I'm going to tell you about. We have another. I don't know if I've ever mentioned Bradford Regional Medical Center in Bradford, Pennsylvania. High Point on Michigan. We have a floor at Larkin at Exchange. We're Oishei Children's Hospital, Millard Fillmore Suburban, Visiting Nursing Association of Western New York, Olean General Hospital in Olean, New York, DeGraff Medical Park, as well as DeGraff Long-Term Care, which are both of our DeGraff sites are located in North Tonawanda. Throughout Buffalo, throughout Erie County, north of Buffalo, south of Buffalo, we have numerous clinics. We have physical therapy facilities. So Kaleida Health we are located in many areas throughout Western New York. And I want to thank you, as always, for listening to our program. And remember, when I see you in the community, I will ask you, is there a program that you've not heard or a program you would like to have re-aired? Because this program is for you. It's for you, our Western New York community. And if you're listening by Google, feel free to send me an email and let me know about a topic that you would like to hear. Or not just Google, but any of the search engines. Well, today, this year, 2025, I've been doing a lot of part one, part two, part three programs. And today is a part two. Part two. What's the topic, Francesca? The topic is we will be talking about the patient and family centered care, which is part of the Children Family Support Services provided by Oishei Children's Hospital. And our guest for today is Mackenzie Matson. Welcome, Mackenzie. How are you? Welcome back to part two.
Oh, thanks, Francesca, for having me back. I'm so happy to be here.
Oh, yeah. There was so much during the last interview that we didn't cover, and who knows, we could have a part three. But let me let our listeners know who is Mackenzie. Mackenzie is a licensed. She has her license and a master's degree in social work, and she's also director of family support services at Oishei Children's Hospital. And if you've not seen Oishei Children's Hospital, how many floors are at Oishei, Mackenzie?
We have 12. We have 12 floors here at the hospital. Yep.
So, okay. and then of those 12 floors, how many floors have children? How many have patients?
Well, I think almost all of them, aside from the fifth and sixth floor, have patients, and our seventh and eighth floors are dedicated to women's services. So we don't have any pediatric patients aside from our little newborns.
Yeah, but they are patients in the making.
Yes, they are. They absolutely are.
Patients in the making. And I guess I'm saying that for our listeners because you're director of family support services, which are basically services on every floor in Oishei Children's Hospital. And that's why this is part two, because it's an enormous undertaking for each of the supports. But today we will be talking about patient and family centered care. And so how would you define family support services?
So we have a really robust team that works within our family support services division here at Oishei. So under that kind of in our division, we have things like volunteer services, our child life team, our social work team, our spiritual care team. We have Stone's Buddies, which is an outpatient program for kids with chronic illness. our patient and family relations department. So if families are needing some advocacy while they're in the hospital, that kind of falls under the family support services guys as well. And of course, our healing arts program and our artists in residence. So really any department in the hospital that's touching the, psychosocial and emotional well-being of kids.
Yeah, and you know what? And family advocacy wasn't a question for today, but it might be part of our part three.
Sure. Yeah.
So then, so why is it important for Oishei Children's Hospital and the community to have this enormous family support services?
We're serving families all across Western New York, many of whom are traveling from out of town to come and seek services or are transferred here for our level 1 trauma center. So we certainly have families, when you're bringing your child to the hospital, it's not your best day.
No.
So we always want to have a team of supports available to help the patient cope with their hospital stay and understand what's happening in the hospital, help and support our parents who are going through kind of, just a really difficult and challenging time with their child. And we know that if parents are coping well, the kids are coping well. So it's just important that we are kind of wrapping them with all the supports that we can to help normalize their hospital stay and kind of meet their basic needs while they're here.
I want to say, not only is a child doing well, the patient, so are the siblings and anybody who's a part of that system.
Absolutely. Yes, Francesca, it's definitely a whole family approach.
Yes. So what we're talking about, we have family support services, then we have patient and family centered care. Are those the same, or is that, or are they different?
They're really not. I mean, patient and family centered care is kind of a model with which the entire hospital operates. So from doctors to nurses to social workers to child life specialists to environmental services, it's the way that we're engaging patients and families while they're in the hospital. So really including parents and patients as part of the care team and decision-making process as well, talking through what's happening with their child, the testing that may or may not need to be done. And really it's a shared decision-making model between parents and physicians, nurses, and kind of all of those folks that are caring for the child at the bedside. So it's really a model with which we operate to make sure that we are always putting the family first and really including them in, decision-making and rounding and all of those things that are happening every day.
And something just popped into my mind. We are this WFO, the listeners, many of them are strong in their faith. So when we talk about family support services, can the minister or the rabbi, the imam, imam, can they also be part of conversations that are, geared towards the, family of that child?
Absolutely. We have a spiritual care coordinator here who kind of coordinates all of the, if we have a need to bring in, you have a family who comes in of a certain religious faith, and we want to make sure that we're providing culturally competent care. They're able to reach out to their connections in the community and make sure we have an imam available, a rabbi available. Certainly the family is welcome to have their own personal, pastor or rabbi come in to be with them. And that happens frequently, and we welcome that. But if the family is looking for some support in having their child blessed or whatever is appropriate for their faith path, we certainly work with our community partners to make sure we're providing culturally appropriate care.
Well, that's great to know. So at the patient and family centered care, and you just mentioned advocacy. So if the parents have a question, let's say about a child's surgery or home therapy or anything about the next steps, I guess that's what I was kind of thinking about, next steps. Is this where they would go, or who would they go to if they, if they just weren't sure, or they just wanted to know, why is my child 5 hours later, they're still in surgery? Is this a person they would go to? Are you?
Yeah, certainly. So there are a lot of members on my team that would field questions like that. So they certainly could reach out to any member of their care team, the nurse, the physician, the social worker or child life specialist, but we do have Stephanie Fernandez Baez is our patient relations coordinator here at the hospital. And so if they're really feeling like they need someone to help to have their voice heard, Stephanie is the one that they can go to. And she's usually brought in by our social work team or a child life team, or sometimes our physician team, if they're feeling like the family needs a little extra support or a bit of help kind of conveying their concerns and communicating with the physician team, then Stephanie's there to support them in that. So, yeah, she does a wonderful job. It's a newer position that we have here at Oishei. We had, something similar years ago, and we've been able to bring that back. And it's really, she's an integral part of the team, and is really able to help families who are struggling to navigate the hospital system. She's really able to help them with that.
What if someone is, as a child getting ready to go into the hospital, is there an email address that they can or how would they, if they have any questions before going
Yeah.
there, how would they
Honestly,
contact?
honestly, I think for that, if you have a child that's coming to the hospital and you're, having questions or concerns about hospitalization, or they want to prepare their child for what they're going to experience here, a child life department is really the first point of contact for something like that. So they can be reached at 716-323-1520. And they can set up a tour, a pre-admission or pre-surgical tour. They can ask questions. They can give the parents recommendations on what to bring with their child to the hospital when they come for an admission, if it's planned. And then certainly they're and available every day to, help to meet with the family and prepare the family for what's happening next and helping them understand what's going on in the hospital.
Could you say the phone number just a little slower?
Oh, sure. Sorry, I'm a fast talker. It's 716-323-1520.
Thank you. And you just mentioned tours. When are the tours? Is it anytime if someone gets off work at 9, or are they or 6 in the morning? What time, and do tours take? What are the times of the tours? Number one, and number two, do they take place on the weekends?
So the tours are planned individually based on the family's needs. So we typically do hold pre-surgical tours on Saturdays, although more recently we've been more flexible in that. So they just, call and reach out to our child life team, and they will do what they need to do to accommodate you and make sure that you have what you need prior to your child's hospitalization or surgery. So they're very flexible, very willing to accommodate the family.
You know what? Do they? I know on the when I'm on my way to well, and any department over at Oishei, and over by there's a little delicatessen over there. No. Passing through there by the security guards, there are those little cars. Do they still use those little cars for children?
Yeah, we're talking about
Little race cars. For
yeah, they
listeners who
are.
don't
Yeah,
know, they're these like they're these white race cars that they look like you see in the Grand Prix or something.
yes. We are we're kind of talking about how to best use those, get the most use out of them. So that's kind of an ongoing conversation. But yes, we do utilize them, and they are a lot of fun.
Okay.
Great partnership with Fisher-Price.
Yeah, they're under lock and key, so you can't. Yeah, there's a gate, a lock gate, so no one can take them out. But I just think they are so adorable. Okay, how about the Patient Family Advisory Council? And I think that's what caught my eye when I was looking at the website.
Yeah.
And I saw this patient and family centered this Patient Family Advisory Council.
Yeah.
What is that, and how does one get involved?
Well, we absolutely love people to become involved in our Patient and Family Advisory Council. So essentially, it's a group of parents whose children have active experience here at Oishei, have utilized our emergency department. Maybe their child has a chronic illness and they utilize our outpatient services. And we come together about 6 times a year with different speakers from the hospital, different departments that are needing input from a parent's perspective. And so they're offering a parent's perspective in decision making here in the hospital. So marketing will sometimes come and run new materials by our patient family advisory council. We've had our director of our outpatient clinics come and kind of talk about throughput and flow and what would help things to operate better in our outpatient space. So it's really an opportunity for our hospital leaders to come and talk to a group of parents who have experience, using our system, utilizing our clinics, and, being in our hospital, to get feedback and to make some process improvement and make things better. So we are certainly open to anyone whose child has been in the hospital, utilized our emergency departments frequently, to come and join our council. And I'm happy to share the contact information with you for that, Francesca, if
Okay.
listeners are interested in getting involved.
Okay. So it's but it's for those who have had children in the
Yes.
hospital, right?
Yes.
Okay.
Yes.
Okay.
Yes. Yes.
I love children, but I only have the imaginary ones, but I do love them. I love them. They're
Yeah.
so sweet. I mean, it just puts a smile on your face, walking through the hospital, through Oshai. Like I said, if I'm going to another department, it's just, the other day, I was going to tell a story. This little boy was saying his ABCs, and he said, "Will you sing along with me?" And I'm just walking by the security guard's desk, and I just started singing with this little, like, 3-year-old, whatever,
Oh,
just learning his ABCs, and I don't know,
that's so sweet.
it just put a smile on my face.
Word.
Yeah. So patient advisory council. Let's talk a little more about that. So you said you meet about 6 times a year.
Yes. And there's always a virtual component. So if people aren't able to come in person to the meetings, if transportation is a barrier or they live far away, we always have a WebEx link call-in option so families can participate virtually. And then we do have about half of our meetings in person. So if they want to come to the hospital, we provide dinner at the meetings, and it's a good opportunity to chat with other parents, but then also, get to interact with our leadership teams face to face. So,
and you just said dinner. So what time do the meetings?
Meetings start at 6, and they usually last between an hour and a half. We're maxing out at 7:30. So sometimes we're done a little earlier, sometimes we're done a little later, just depending on the agenda for the week.
How about parking? Is parking included, or is it up to?
Yes. Yep.
Okay.
We validate your parking. So if a family is coming for the Family Advisory Council meeting, they are parking in the ramp, and we are validating their parking. So they're not paying the parking fee.
Oh, great. Now, does someone have to supply a resume? Is there I'm just saying, is it resume, background check? I mean,
no, not a background checker. We're
Okay.
not unless there's one of our work groups that would involve them coming into the hospital and doing some volunteer work with patients. They don't have to go through the full volunteer vetting process. It's an application, and there's a meeting with Kristen Williams, who's our supervisor here at Family Support Services. So there's a meeting with Kristen to kind of talk about their experience and why they want to be on the council. But no background checks or anything like that for the council.
Is the application online?
It's not. So I can give you the phone number for Kristen Williams, who is the supervisor of Family Support Services, and she directly oversees our Family Advisory Council. And if anyone who's listening today is interested in participating, please give Kristen a call, and we would love to hear from you.
And do you have a number for her?
Sure. Yep. It's 716-323-2423.
And this is the phone number of Kristen Williams.
Yes.
Who's responsible for the Patient Family Advisory Council.
Yes.
At Oshai Children's Hospital. And could you give her phone number one more time, please?
Yes, I can. It's 716-323-2423.
Thank you. Something else I wanted to ask you about as we talk about Oshai Children's Hospital, Patient Family Care Center, Family Support Services, Translation Services. Do you provide translation services for all the children and the families coming into the hospital?
Yes, absolutely. We actually have an iPad system where we have a couple of iPads on wheels on every unit, and we have a live translator that will come face to face on the iPad for translation, because we know that can be helpful, kind of having those face to face moments.
Yes.
Obviously, in person interpretation is always preferred. But if we aren't able to arrange that, then we will use our iPads, and they work very well. They have almost every language out there.
Okay.
And it's a live person that's there to face to face translate with the family and the physicians and the staff, whoever's meeting with them.
Yeah, thank you. And now again, because I work at the hospital, I remember when, because I work for Kaleida Health and I work in Buffalo General. I remember when the hospital first opened, and the rooms at Oshai Children's Hospital for the children and for the moms delivering babies are beautiful. The new hospital has gorgeous state of the art rooms. And I was just speaking with someone recently, and I was talking about the rooms. Do they still, for the children, do they still have like the stations that are part of some of our cultural institutions in Western New York, such as the zoo, so the children can watch
Oh, yes.
Okay.
Yes, we
Okay.
still have Zoo TV. So
Zoo
that's a live feed from the Buffalo Zoo right into the patient's room here. And so, yes, that's been an amazing partnership. That's been longstanding, and patients can click on Zoo TV and see live action from the Buffalo Zoo with different animals all around the zoo, and it plays music and kind of rotates through the zoo exhibits. So that is really fun. And then, throughout our hospital, we display, many different art pieces of artwork from local artists and different cultural organizations throughout the community. So that's been a big undertaking to get the hospital to feel warm and inviting and relaxing, and just a very serene space. And so that's also part of our cultural initiative as well.
Mm-hmm. Mm-hmm. Yeah, and then I know that in the rooms are, so the child can be watching the Zoo TV, and I believe that on the other side there's like a comfortable area for the parent or the
Yeah,
loved one to
yeah,
stretch out, and if they
yep.
want to watch something else, they could do that too.
Yes, they have their own little TV. So parents have their own little mini TV that they can watch their own show on and relax on the couch
Yes.
while the kids are watching what's, helping them to relax and heal. So absolutely.
Yes, I love that. Relax and heal. Well, now I'm going to ask you about you. And
Okay.
so what are some of the steps if someone is listening and saying, "Oh my God, this job sounds really cool. Like they like working with children, but they say they don't have children, but they enjoy listening to everything and everything that you do as a director of family support services." What got you to this point in your career?
Oh my goodness. What a big question,
I know.
Francesca.
I
um,
remember I am manager workforce development, so I'm always,
I
looking at
know.
workforce.
No, I know you're doing amazing work. So,
Thank you.
I actually started here at the Old Children's Hospital Buffalo in 2006 as a child life specialist. And so when I went to my undergrad, I focused on early childhood development, psychology, sociology. And then I was fortunate enough to get an internship with our child life team at the Women and Children's Hospital Buffalo. And then fortunate enough that there was a job opening that I was able to interview for and got the job. So, over the years, there have been, just Kaleida's been very good to me. I did was bumped from my child life position at one point, but was able to come back per diem and work with the team. I was then, had the opportunity while I was working per diem to go back and get my master's in social work at UB. And so that was a great opportunity. And that, when I was done, there was a terrific position open with our YouthLink program at Town Garden Pediatrics at the time that served youth who were living with HIV and young people who were survivors of sexual assault. So I did that for three or
Mm.
four, yeah, I did that for 3 or 4 years after I got my master's. And then there was a management position open to manage our child life team and patient and family centered care and also volunteer services. And so I didn't have a lot of managerial experience, but I did have experience as a child life specialist and with volunteer services and all of those things at the hospital. And so took a leap of faith and applied and interviewed and got the job. And it's just grown. And since then, we've been able to really grow our family support programs. I've started overseeing our Stones Buddies program.
I say Stone's buddy. I'll never forget meeting him. Oh my gosh,
Oh, I
amazing.
know, Stone. Yes, I know. I know. Our spiritual care team then kind of came my way. And then we just kind of started building this model of having a division of family support services that reported to someone who had really done the work. And so, for me, I think part of my success is that I really genuinely care about the work that we do. I also genuinely care about my staff and my team and everybody that I work with. And we've been fortunate enough through partnership with our foundation to really build these programs and expand the work that we're doing in the hospital and just create this really amazing group of people who are just here every single day to meet the most fundamental needs of patients and families. And so I'm just so grateful to Kaleida and Oishei for supporting me in my journey as a leader, but, also for recognizing the importance of family support services and the work that our child life social work, patient relations, spiritual care teams are doing on a daily basis to help these families. So that's just kind of a snapshot of my journey there.
And I have to say, there are amazing programs. You talk about the foundation. I mean, I know that the Buffalo Bills often come through, and not only does that building, not only is it building the putting a smile on the kid's face, they may or may not know, but it puts a big smile on the parents' face, and you never know when they're coming because I've never seen them in the hall, so I just know that that they are there. But Mackenzie, we only have less than a minute left. So I just want to thank you again. You talk about all of the support of the hospital. I just want to also say, if you haven't been in well, hopefully you never will have to be, but if you have to be, it's a very comfortable environment. They have long cushions for you to sit there with your children while you're waiting for an appointment, so you don't have to sit necessarily in there. There's just so many things I could go on. This is just walking on one floor. I've only been on one floor for the most part, but I want to thank you for listening to our program this morning. Mackenzie Madison, licensed master social work, director of family support services. Thank you for being our guest this morning on the Great Lakes Health Radio program.
Thank you, Francesca. Truly appreciate your time.
Oh, you're welcome. And listeners, hold on. Within 5 seconds, you will hear part 2 of our program. And now on to part 2. And welcome back to the second half of the Great Lakes Health Radio program with your host, Francesca Masaya, Manager, Workforce Development. Well, I tell you, this has been, each topic I feel is just, just so enlightening. It's so educational. And I'm hoping you, the listener, our listeners in the community feel the same that I do. And I want to thank you again for listening to the show. And again, when I see you, please let me know if there's a topic we haven't covered or if there's a show you would like for us, because it takes a village to put the program together. If there's a topic you would like for us to repeat. Well, today we will be talking about services provided by Family Planning Department. Normally, at least once, possibly twice a year, if you're new to listening to our show, we always have Kaleida Health Family Planning and a representative from Kaleida Health Family Planning. And so I know we haven't had anybody recently from Family Planning. So I want to introduce you to Danielle Gates, community educator. Good morning, Danielle. How are you?
Good morning, Fran. I'm good. Thank you.
And Danielle is not new to Kaleida. Matter of fact, when I first met Danielle, how many years have you been with Kaleida?
26.
Okay, you've been here 6 years longer than I have. So I've known Danielle. She hasn't always worked in, at family planning, but welcome, Danielle. Is this your first time doing the show?
No, I think I did it last year with Sherry, the
With
manager. Sherry,
Sherry.
our manager. Mhm.
Yes, yes. I remember. Okay. So anyway, for our listeners, what is family planning at Kaleida Health? And has family planning always been part of the Kaleida Health family? And for how many years? Guesstimate how many years?
Okay, so family planning, it is a specialized clinic or facility such as ours that provide reproductive health services to women, men, and teens, which include counseling, education, and assisting with access to contraceptive methods to assist individuals or couples with the planning or spacing of pregnancies and promoting of healthy pregnancies. In regards to family planning as a whole, we've been around since 1972, which makes it 53 years this year. And it was originally known as the Deaconess Family Planning Center. So when Deaconess closed, they rebranded it and renamed it as Kaleida Health Family Planning, but the services are still the same.
And what was it called, Deaconess? What was it?
Deaconess Family Planning Center.
I remember when it was starting at Deaconess. I remember when I started with Kaleida, because I used to bring magazines for the waiting room. So patients would have magazines. Do you still collect magazines? Do you still
Yes, we do.
take?
Yes.
Okay, all righty, all right. That's good to know. Um, where is family planning located, and what are the hours?
So we are located at 1100 Main Street between Summer and North Streets. We're basically right across the street from Wendy's. We are located on the NFTA bus line, and we are closest to the Summer Best train station. And in regards to our hours, so we're open Monday, Tuesday, Wednesday, and Friday from 8:30 to 4:30, and on Thursdays, which is our late day, 11 to 7.
Mm-hmm. Um, before we even, well, what we're going to first talk about, how does one make an appointment, and then we're going to talk about the services. So how does one make an appointment, or is it just walk in?
Well, if anyone wants to make an appointment, they can give us a call. 716-748-4988 is our telephone number. We do have a website, which is yourbodyfirst.org. So, like, if we're closed, someone can send over a confidential appointment request with their information, and then we'll call them back, and then we'll set them up an appointment. And then, or they can just Google us, which most people does. And yes, we do accept walk-ins as well.
Mm-hmm. How about insurance?
Um,
Insure is insurance required?
no, insurance is not required. I mean, we do accept all health insurances. However, it's not required. We are federally funded, so we do have a program called the Family Planning Benefit Program, and services are free for teens aged 13 through 19. And for those who are uninsured or underinsured, services may be offered at a low or no cost if eligibility requirements of the program are met, such as income and family size. So no, you don't have to have insurance.
Okay. And the reason I ask those questions first before getting into the services is because I just want people to know where it's located, the hours, so you have an idea, beginning to get an idea of family planning. And
Mhm.
you just said that you service women, men, and teens.
Yes.
And so let's just start with a overview. And I'm going to say men because I think, did I forget men were service? But what are the services that are provided for men? And are they also like men like ages 13? You just mentioned age 13 through 19. So What age and what services are provided for men?
Well, as far as men, we do STD testing and treatment.
Mm-hmm. So
Hmm.
tests. Okay. Um, and is a STD test something that you find out right there? You got to come back after like, yeah.
Well, no, we test right here in the office. So depending what, their symptoms are or what it is that they're requesting, we'll test them in the office. We send it out and usually, depending on what they're, coming in for, results come back the next day. For other things, it may take a couple of days, but the turnaround time on getting results are very quick.
Okay, thank you.
Mhm.
And then for teens, what are the services you provide for teenagers?
The same. Most teens come in, for STD testing and treatment, but we do provide birth control for teens at no cost. Um, we do pregnancy testing. So just an overview of all the testing that things that we do here. We do GYN physical examinations, blood pressure screenings, colposcopy services, which checks a woman's cervix for cancerous tissue, pap smears, treatment of certain vaginal infections, pregnancy testing, natural family planning counseling, STD testing and treatment, HIV testing, counseling and referral, and HPV vaccines. So those are the services that we do provide here. So usually, like I said, with teens, they'll come in for the STD testing and treatment, pregnancy tests, and vaginal infections.
Mm-hmm. Um, Now sometimes I know that teens, especially teens, I'm just gonna teens or even people in their young 20s, they like to bring a friend with them. Like they
Mhm.
like to bring a friend with them everywhere.
Yes.
So what if, someone what if someone's listening right now and they're 16 years old,
Mhm.
but they need that support from their friend. Can they bring their is that friend welcome to have a seat in the waiting room?
Yes, like we have a lot of teens to, bring a friend or two for support, which is, good. But we restrict them to the waiting room area because we can't have them, in the patient rooms due to HIPAA guidelines.
Hmm. Yeah, thank you. How
Mhm.
about women? What are some of the services provided for women age? Well, what's the oldest, like what's the age of women that come to your clinic?
We have all ages. We have, some women who are well into their 70s who have come into the clinic for, treatment and, services.
Okay. So,
Mhm.
and that's something important. So, let me ask you a question.
Yes.
I was just talking to someone the other day who said they haven't, seen a doctor or someone to get a pap smear since they
Mhm.
had children. And you just said someone's 70. Is someone at 70 having a child?
Well, if someone is sexually active, then, they can come in and get a pap smear and things like that because we still have to check for things such as cervical, endometrial cancers. So, that may be a reason why someone of that age is coming in to see us, especially if they're, sexually active.
Yeah. Um, so if someone is pregnant, do they get the services there, or do you then refer them to a colitis site, for women's services site?
Yeah, so if someone comes in, we test them for pregnancy, and if it's positive, we'll refer them out to one of Kaleida Health's clinics, either Kensington or Niagara OBGYN, because we don't see pregnant women here. We just strictly do, GYN services.
Okay. All right. So we talk about teenagers. What makes family planning unique for teens?
I think when it comes to teens, the big thing with them is confidentiality because they don't want anyone or their parents knowing that that they have come here. So, we try to gain a rapport with them, gain their trust to let them know that, no one will have any information about their visits unless they give them permission. We let them know that this is a safe space for them to come to for like contraceptives and STD testing and treatment. And we also try to accommodate them with appointments because we know like they're in school all day and sometimes our hours, don't meet, their requirements or their schedule. So we're very accommodating, to them.
Do where yes, it's summer now.
Mhm.
And I know sometimes people have summer hours.
Yes.
Do you have summer hours, or do you have the same hours throughout the year?
No, we have the same hours throughout the year.
And and what are those hours again?
So Monday, Tuesday, Wednesday, and Friday, 8:30 to 4:30. And then on Thursdays, 11 to 7, which is our late day. Thursdays tend to fill up a lot quicker because we're accommodating a lot of working adults or the kids who get out of school. They'll come in right after school for the 3:30 appointments. So Thursdays usually fill up really quick.
Okay. Okay, that's good to know. So the roles of the staff, this is a medical um facility. So what is your role, and what are some of the roles of the other staff members there at family planning?
So there's 8 staff on site, including myself. My role is a community educator, so I go out into the community and I provide outreach. Um, so we have a patient registrar who registers and makes appointments along with other duties. 2 medical assistants who work alongside the providers in a clinical aspect doing like vitals and labs. We have a nurse practitioner who specializes in women's health. And then we have our manager, Sherry Curry, who oversees the clinic and the day-to-day operations. We have an executive administrative assistant who basically like keeps us all together and makes sure that we have everything that we need. And then we do have a medical director on staff who also sees patients, and her name is Dr. Benita Lipford.
Hmm. And also, listeners, Sherry Curry used to be the community educator, correct?
Yes.
Yeah, and now she's director. So um it's just very generic in terms of how Sherry grew up, not say grew up, but she started working with family planning, and she was so she is outstanding, and now she's the director of family planning. And Danielle, who's very familiar with the Colitis system, and Danielle has a great smile. I know we're on the radio, but one thing, Danielle, you were saying about meeting teens, I think not meeting them where they're at, but making them feel comfortable. Listeners, I have to tell you, you can't see Danielle, but Danielle just has a really warm way. So I encourage listeners to encourage their family members, especially teens who may need to go, or interested, or the young men or women, because Danielle is that you're just a very friendly person, Danielle. You're great for the role, not for the role, for the position. If someone is interested in reaching you for outreach, what should they do?
So, well, thank you, friend, for your compliments, first of
You're
all.
welcome. You're
And
welcome.
if someone needs to reach me directly, my phone number is 716-748-4984. And the capacity in which I work is, I do outreach, but I also act as an educator and trainer. I train people in the community about, STDs, birth control, pregnancy prevention, things of that nature, a consultant, and things of that's associated with this job. So it's more than just an outreach. So if anyone needs to contact me, they can contact me at the number I just provided, or they can also reach out to my email, which is dgates@kaleidhealth.org.
Hmm. And I just want to let the listeners also give you ideas of besides outreach, like Danielle said, she does speaking engagements. Sometimes if you're meaning that she goes into schools, junior high, high school, colleges, junior colleges. If your Girl Scout troop has as part of the badge, you need a speaker for health education, specifically just on taking care of yourself. It's not she speaks on more than sexual health. That's what I'm trying to say. So she doesn't have to speak on if you don't like if some of the topics are too controversial, she won't she won't speak on that topic. But if you know you are interested in a community educator and a speaker, again, Danielle, I highly recommend calling her because she's a great speaker, comes with all types of educational information, right?
Yes, here in the clinic, yes. We have all types of informational clinic about everything here. Yes.
Mm-hmm. Mm-hmm. And also, what if someone is a youth advisor? Can they come to family planning without making an appointment just to get some educational information to share with their group?
Yes, yes, they can.
Mm-hmm. So again, we are a resource in the community. Kaleida Health is a resource in the community. Family planning specifically. Tell us where you are again.
We are at 1100 Main Street, in between Summer and North Streets, across the street from Wendy's. It's a brown building. There's a sign on the building that says Buffalo Small Animal Hospital. So when you see that sign, then you know that, you're in the right place.
Oh, thank you. Um, Based on data, what are the top three reasons and maybe yeah, based on data from your office, what are the top three reasons or four or five reasons people come to you? Family planning.
We just went over this yesterday because we did surveys. So from the
Oh,
feedback, yeah, so the feedback that we got from the patients, I would say that one of the reasons is that the rapport that they have with the staff and the providers' vast knowledge and expertise. Like we have patients who have been coming to us like since it was Deaconess. So those parents sent their children here and now they're sending their grandchildren here. So that just goes to show that the rapport that we have with the people in the community. I would say the ease of making an appointment and appointment availability. So, if someone calls, we try to get them in, if not same day, we try to get them in within the next day or the day after that. And I would say the affordability and accessibility of our services that we provide because we reflect the community that we serve.
mm-hmm. Yeah, and there are holidays here. Are you open on holidays?
No, we're not. The
Okay.
major holiday, that Kaleida observes, no, we're not open.
Yeah. How about weekends?
No weekends at this time.
Okay, but do you do outreach on weekends?
I do, yes. If
Yeah.
someone needs me to do outreach, I'm out there on the weekends, yes.
Yes. Yeah. And based on your schedule that only you know best, how much time do you like to have ideally before doing an outreach?
At least depending on what type of event it is, but usually a day or two, just so I know what type of materials to bring if I have to like, print materials and things of that nature. So usually like a day or two.
And I know that some of our listeners are might be listening through the internet. Do you are you able to participate in outreach outside of the city of Buffalo?
I can go anywhere within the county of Erie.
Oh, okay. County of Erie, not Niagara.
No, unfortunately not. The program is only restricted to because I'm sure Niagara County has their own, program through Community Health Center of Buffalo. So I'm only contracted for Erie County.
Okay. All righty. So only for Erie County. So listeners, again, your phone number, Danielle?
716-748-4984.
Mm-hmm. Thank you. And Danielle, this is one of my favorite questions I would like to ask our guests, and I guess from working in the area workforce, what made you prepared for the success in as a community educator? What do you feel has made you the successful person?
I would say that I always had a passion of helping others. My degrees aren't healthcare specific to family planning. However, that passion of helping others led me to this job as a community educator, where it allows me to be out in the community doing outreach to individuals in underserved communities. addressing reproductive health and the inequities to healthcare. It also allows me to dialogue with the teen population and dispelling myths and stigmas in regards to sexual health.
Mhm. So, do you think that social media has helped with people knowing about family planning? Are you on any of the is family planning on any of the social media sites?
Unfortunately, not. We don't. We're not allowed to have social media. Everything has to go through the Kaleida Health website. So we're
Okay.
working. So we're working with them to, try to get us on the Kaleida Health website to promote us out that way.
Okay. All right. That's good. Is there something else that you would like to share with us, with the listeners, about family planning that we haven't covered in the interview?
Well, I would just like to add that, that we are accepting new patients. We accept all insurances. So just remember, if you don't have insurances, you can still come and be seen. And, just our location and hours, as we've been saying throughout the interview, 1100 Main Street. And we have great providers and staff here. When you come in, we make you feel like family. So, hopefully that you guys can just, come out and see us.
Mm-hmm. Mm-hmm. How important is it to keep an appointment? I know sometimes if someone's catching the bus, and sometimes buses wait for you when you run and sometimes don't. For many years, I caught the bus. How important is it for someone, let's say if they had a 10 o'clock appointment and they don't arrive because they have to make a few connections. They don't arrive till like an hour and a half later. Are they normally like, I mean, can you still see them?
Well, basically that's a provider's choice, if they decide to see them or not, because if like a day like today where we are, packed from start to finish, if they can slide them in, somewhere, then they can. But if not, they may have them just reschedule. And we do offer telehealth services for people who, may have a hard time getting to us or, missed appointments. We do offer that service as well.
Okay, and tell me a little more about telehealth.
So what they'll do is, we'll set the time up for the patient, and then the provider will, reach out to them via telephone, and they'll just conduct a visit for things that, that they don't have to, physically be seen for. But they'll, go over things on the phone with the patient and assess them in that way. So at that time, then it'll be determined if they need to actually physically come in, or the doctor feels confident and comfortable enough to prescribe them something, just from the phone visit.
Mm-hmm. Um, what was I about to say about telehealth? So for telehealth, do people then give their uh, share with the do they have to have health insurance? I guess that's my question. Do you need health insurance for telehealth because you're talking over a phone?
It still would be billed like a regular visit. So yes. So like I said, it would still apply whether if they have insurance or not.
Okay, all right,
It's
and
treated like a regular visit. You're just talking over the phone. Yes.
so then a telehealth visit is you. It's just like scheduling an in-person visit.
Yes. The same rules would apply as far as like, appointment scheduling, because we have to block off that time just as if you were here in the office, registration, insurance. Yeah. So if the doctor is treating you, then, you will have to, pay that copay and things of that nature. So same things still apply.
Okay, and now how about if someone has a question, but the question comes in 5 o'clock on a Friday. Do people will when will someone probably get back to you?
Monday.
Unless it's an emergency, right?
Yeah, so on our voicemail, we let them know if it's an emergency, you may want to be seen at an urgent care or an emergency facility. And, if not, once we come in Monday morning, we check all messages and return, the calls back to the patient.
Hmm. Hmm. Okay, so listeners, that's great to know. So if it's an emergency, as Danielle just said, call the number, but you will get to the emergency department because otherwise there'll be someone to return your call on Monday or the following business day. And if the business day falls on a holiday, then it's the following business day and still not the holiday. We have about a minute left. And what's something you would like to share in closing the interview?
First of all, I'd like to thank you for taking the time to, interview me. So I thank you for that.
Oh, you're
And
welcome.
and we just encourage people, to, if they need us, to reach out and, utilize our services. And, basically that's it.
Yeah. Let's keep the community healthy, right?
Yes, yes.
Yeah. And any question, there are no dumb questions. When there are no dumb questions when it comes to your health or the health of your loved one. And on that one note, Danielle, I want to thank you. Our guest this morning for the second half of the Great Lakes Health Radio program has been Danielle Gates, Kaleida Health community educator from our family planning department. Listeners, next week you'll hear from my esteemed colleague, Cindy Bass from Erie County Medical Center. And until then, be healthy, be safe, stay well. In 2 weeks, you'll hear me, Francesca Messiah, Manager, Workforce Development, Kaleida Health. Bye-bye.